Hello and welcome to the Blog and the Broken, where I will be blogging about how broken I am. I had knee surgery yesterday, 2 days, day 1 of recovery.
Woo! Yay!
And I am on so many pain medicines, I feel great. Yeah, so I'll just tell you about the surgeries that I have had and why they were necessary today, and then maybe I'll get around to some actual recovery blogs tomorrow. Super. Here we go! So, this is my awesome splint. It's called a Zimmer splint. This is my 6th Zimmer splint I've ever had in my life. They're pretty ridiculous, and they suck. The surgeries I have had. I've had a scope. So this scar right here, that looks like a big cigarette burn or something on my leg, that's where the scope got infected. It's supposed to look something more like this little one here that you can barely see, but it got infected. At one point that hole was the size of a loony. A loony. Then I had a bilateral Fulkerson osteotomy, but it was done in 2 parts. One was the right leg, then the left leg. This is your kneecap, also known as your patella. This is your femur. It is the biggest bone in your body. And this is your tibia. This is a slight rendition of a fibula, but really it's not important. It has nothing to do with this. So, in a Fulkerson osteotomy, if this is the outside of your leg, obviously, and this is the inside, what happens is my patellar ligament, which attaches like so, was too long, so my kneecap would just flop that way whenever it felt like it. So what they did in the Fulkerson osteotomy is they cut the bone right here and moved this junk over about 1 centimeter that way, and then they screwed it into place. Super, right? So that's the scar. I don't know how super you can see it, but it's a good 6-7 inches down my leg. And that's from the first Fulkerson osteotomy. Then I had hardware removal and a scope of the right knee. Then I had a lateral release and quadriplasty, which is what I just had. So the next question is, why would you need all this surgery, Cody? And the answer is, because when I was born, I was pigeon-toed, which means I walked something like this. Doctors fixed that by making me wear my shoes on the wrong feet. They're backwards.
There were times when Richard had done something wrong.
Which is weird. I know. But by making me walk normally, I walk too normal. You see, normal people walk with their feet kind of slightly outward like this. I walk with my feet perfectly straight, but they're used to being like this. Check out my badass muscle. Bam! Bam! Also from walking funny. Bam! So that caused problems for my patellar ligament. Kneecap, patellar ligament. And so it became too long, and my kneecap would just dislocate randomly whenever it basically felt like it. They fixed that. But they didn't do a good enough job with the Fulkerson osteotomies, so now I've had a lateral release and quadriplasty. In a lateral release, what they do is there's a bunch of muscles and junk over here that pull your knee, and there's also a bunch over here that pull your knee. So what they did was they cut the ones on this side as well as my quad muscle right about there, and that means that it's going to pull less in this direction and more in that direction, hopefully fixing the tracking problem in my knee. And so that's about it. All the surgeries I've had and why. I'm about to take a bunch of these and take a nap. Later days.